So, welcome to this third talk on childhood and adolescent problems. So, if you remember in the last two lectures, we generally had an overview of what could be a problem and what could be a illness. There are illnesses, as I showed you in the epidemiology. So, today we will be talking about one of the major illnesses, which is a illness like schizophrenia is a illness and bipolar is a illness and OCD is an illness in adults. One of the major illness which is found in children is called autism. It is like a maze. It is a maze for anybody who tries to understand and for the kid himself. But in one way, autism, we consider it as an illness and try to treat it, and we are still trying to find out the exact treatment and solutions for it. But autism, if you look at it, you must have heard of this term, a common term which is used these days. One of the films called Rain Man was the thing which actually brought out into focus, although the illness has been known for very long. Autism is a different makeup of mind, and some people, some high functioning autistic kids, adults also say that we are not ill, why are you trying to treat us? So, this is one of the good expressions which I picked up somewhere, and I almost thought I will show you that it is a cat, it is not a defective dog. So, cat is happy being cat, it is not a dog. So, any attempt to make cat into a dog will fail. Whether we have to facilitate them to be a cat. So, if you try to understand it this way, so just read this, I am first and foremost a child is just one aspect of my character. And these are almost like symptoms. Ordinary sights, sounds and touches of everyday life that are normal to you can be painful for me. It is not that I do not listen to you, it is just that I cannot understand you. I like routines. It is hard for me to tell you what I need when I do not know the words you say. Be patient and consistent, focus and build of what I can do rather than what I can't do. I will just come to what it all means. So, this is the history. 1943 Leo Kanner defined infantile autism, 44 Asperger's, 60s separation. It was thought that it is one sort of schizophrenia, that somebody is developing normally and develops schizophrenia, but it is different. Right from their birth, they may be normal at till 2 years of age, but most autism develops by 3 years of age. There is a separation from schizophrenia happened around 60, understanding biological and genetic underpinnings, and then this whole diagnostic thing. Pervasive developmental disorder is a broad term for a lot of these illnesses which are clubbed under one. Autism disorder, PDD, NOS, Asperger's disorder, autism spectrum disorder. But what we are seeing, or maybe we are seeing because we are trying to understand it from the term of disability. I am still not sure about it. If one considers it a disability, or if you accept that the person is like this, then it is not a disability, as that kid has written. That I am a cat, I am happy being what I am just different. I may not understand the words you are saying, I may not respond to stimuli as I am responding, as you respond. Some touch may be very painful to me, something may be very disturbing to me. There is an actual increase in the incidence. Initially it used to be 1 in many hundreds, then it became 1 in 150, and now it is 1 in 89 kids all over the world. It could be because that we are identifying it more, and the better treatments have given a hope. Now, this is a treatment, or we are just trying to bridge the gap between this autistic kid and the normal kid. So, the controversy is still raised. We can define who has it, we have no idea what causes it. We do not know if it is increasing, whether we are identifying more or it is increasing. If it is increasing, we still do not know the cause. We can make it better, but there is a whole lot of market which offers right from diet to some meditation to some exercises and some stem cell therapy. But in one word, if it is a illness and we think it is a illness, there is no definitive treatment for it. So, there is a whole lot of, what are the core symptoms? Core symptom is speech and communication, social anxiety, restricted interest, intellectual. So, these are a lot of overlaps. If you look at it, you find EEG abnormalities here, you find immune dysfunction in some, you find some OCD symptoms, you find social anxiety, there is a social impairment, aggression, attention deficit hyperactivity disorder here. So, there is a lot of overlap. What is happening? Core symptoms, if you look at it, if you ask me, are this. There is a impaired social communication, there is a restricted repetitive behavior. So, communication in the sense of social reciprocity, non-verbal relationships, repeated behavior, insistence on sameness, interest and sensory abnormalities. You can find rest language impairment, intellectual disabilities, genetic problems, like these are some genetic things which have, it is very well comorbid with Fragile X, which is a genetic syndrome found in boys. There is something called Rett syndrome which is in girls. So, these are all things which you find in genetics. Increased level of serotonin has been implicated in the blood, altered immunology, there is a altered brain region size, as we find lot of it in schizophrenia, we find in different type of things in brain region and all. Problems with developmental, physical developmental parameters, abnormal EEG, you can find epilepsy along with it, and then lot of behavioral issues, aggression. These are all comorbid symptoms which could be part of the autism or may, so not everybody has all this, but the core symptoms of autism, if you ask, are the child in simplest word, the child is lost in his own world, does not use language for social communication, insistent on some repetitive stereotype behaviors, and is hyper or hyposensitive to certain stimulus. So, what you find is in a kid, and this can range from say very mild autistic child which we call Asperger's syndrome or high functioning autism, that may be doing other things, but generally lost and in his own world, not responding, to an extreme where the child is not at all maintaining eye to eye contact, is not interested in the environment surrounding the him or her, is not using language except once in a while to communicate. Not using language for social communication does not mean the child does not have language. In fact, some of them have very high. So, having language and a high IQ, not having a mental retardation are good factors, prognostic factor. But a child may suddenly burst up singing a song in a very repeated tone without any emotional intonations of a different language which nobody has ever spoken in the house, or child may be responding very well to the, some other stimulus, like some kids they just, if you give them a huge set of writing, they will immediately pick up grammatical mistakes without really knowing the language. Some kids are very good at mathematics, not all kids are good in, have one or two specific skills, but some of them really are very exceptional in something. They used to be called like idiot savants in old days. We still find in lot of, a lot, I should not say lot, in some of them one or the other skill overrides the other skill. So, they have language, they do not use it for social communication. In the reciprocal play where understanding the other's emotion and interacting is important, that is lacking. So, we suspect that there may be something wrong in the areas of the brain which actually control or exhibit empathy, insula and cingulate gyrus, part of cingulate gyrus. The third thing we may find is that they may have repetitive behavior. Some kids will get stuck to one object like rotating balls or toothbrush and keep doing same thing again and again. The insistence on sameness, if you change their routine, change their timetable, they will get very upset. and sensory. Lot of these kids you find flapping or jumping and getting hyper excited, partly. So, when we will talk about this when we talk about the theories. So, how do we identify early onset? First we were looking at, when we initially used to diagnose, we used to look at the autistic symptoms, the onset of autistic symptoms. We have changed this angle a little bit. Why we are identifying early is we also look now, if the child is developing normally say around 1.5, 2, 3 years of age, and the child starts regressing, the motor, the social, the emotional, the adaptive milestones start falling, that may be the first sign of autism. What are the implications? The implication is, now we find that what was once 1 out of 2500 became 1 out of 500 in 95, and now 1 out of 88 by Center of Disease Control 2008. 2010 still brings it down further, you can see this. So, DSM-5, which is the newest version of diagnostic and statistical manual of diagnosing psychiatry illnesses, they can be difficult both within the spectrum and across other disorders. So, there is a lot of overlap as I showed you in that. So, autistic Asperger's, which is a high functioning autism, and there is some non-specific type of pervasive developmental disorder which may have autistic traits and not really be core autism. So, as I said, deficits in social communication, all three have to be there. Deficits in non-verbal communication, deficits in social and emotional reciprocity, deficits in maintaining relationships, right from childhood. Right from childhood, early in childhood, repetitive pattern of behavior, 2 out of this, stereotyped motor or verbal behavior, as I said, jumping, flapping, playing with something, unusual sensory behavior. They may be very sensitive to maybe putting a toothbrush or to warm water, and they will suddenly become very excited, or to loud sound. When they hear a loud sound, some kids go out, and when there is a honking going on, they become very upset. Excessive adherence to routines and ritualized behavior, restricted interest. They present early childhood, manifest when social demands exceed capabilities. So, when does it happen? When the child is normally, if child is kept in a deprived environment, the social demands of talking, of expressing, of asking your thing, or giving a social smile, or playing with other kids is not required when you are 1 or 2 years. It is possible the kid may be having all this, but because the environment is not such where all these skills are required. So, it first exhibits when you are going to the school, or when you have to step out at 3 years of age to play with other kids, or when you become slightly more expressive and talking, and when you are expected at 3 years of age to ask for something or make eye to eye contact or wish, then these things suddenly come to the front. So, there is a very complex neurogenetic origin, we still do not know, we have theories for it, like one of them is a central coherence theory, which assumes that all our senses take the inputs together as we are talking about development, puts it, integrates it, and makes one coherent picture of the world outside. Possibly the autistic brain is not making a coherent picture of the world, and all things are running haywire, and it depends on which stimulus and which sensation the child starts responding to, and he starts behaving abnormally. So, derived from this is what comes is called sensory integration therapy, which is an essential part of the training of autism. Now, again, what we are trying to do, but I will come to that. Evidence is again male preponderance, 3:1 to 4:1. There is a huge familial risk, monozygotic twins 58 to 96%, but still not 100%. Dizygotic SIBS, the risk increases, and 1% risk like schizophrenia in this we have already talked about. This is an ICD-10. So, this is a spectrum disorder where some traits are present, some are not present. But again, as I go back, we talk of illness because these kids are not fitting into the development which is shown by other kids. What we understand is that their brain is made differently, and that is why see, like schizophrenia comes later in the age when the pruning is happening, and so schizophrenia is an illness of an adulthood, although it may start at 16, but there has been a normal phase. And so, it is not a developmental, there may be a neurodevelopmental theory of schizophrenia, but schizophrenia is not a developmental disorder. Cause may be developmental. So, the person with schizophrenia has seen a normal life. These kids may have this temperamental thing, they may be developing normally, but suddenly something switches on, or it just as you saw in the previous slide, as the pressure of the environment increases, the whole thing is switched on and then it goes on. So, their development itself is different. So, what we are trying to do is bring these different kids nearer to the mainstream. So, go to the first slide. The cat is a cat, dog is a dog. Let him be the cat, let cat be the cat, do not make a dog, but let it better be adjusted with the doghood and cathood. So, people with autism, any attempt to change them to make them like us, we do not know the way now, someday we may, but till that time what we are trying to do is, if you look at it, so what we do is earlier diagnosis helps you in early intervention. We remember the brain grows till whatever 17, 18 years, so that is the window where we have to work. So, optimal intervention, core features, social communication, cognitive adaptive functions, fully integrated classroom. So, if we separate them as disabled kids and leave them in the way that they can develop on their own, they would get separated from the society. So, that would defeat our purpose of mainstreaming them. So, we need more classroom placements, potentially promoting adaptive independence, which means that as they grow, they should also develop a skill of being on their own, because with their lack of social communication, lack of language, the language for social use, and being very restricted in their behavior, may actually not allow them to fit it into the normal mainstream, and the cost of it. So, these are the basic aims. So, how it is diagnosed? As I said, there is no definitive medical test. Team uses interview, observation and a specific checklist developed for this purpose. They may include neurologists, psychologists, speech language therapists, learning consultants, etc. They must rule out mental retardation, hearing impairment, behavior disorders and eccentric habits. So, in presence of these, autism may not be very definitely be diagnosed. So, develop concern, discuss accurate diagnosis, do a effective treatment, and as I said, so these are signs we are talking about. So, we are actually not very far from the untreatable era. There is no definite treatment. 2% functioning normally, 60% requiring institutional placement, and we are talking about 97. There is something called applied behavior analysis, 9 out of 19 recovered on normal functioning. So, the methodological concerns are very important. Over short periods of time, we focus at language acquisition, non-verbal communication, reduction in challenging behaviors like aggression and repetitive behavior, social skills. Over longer period of time, we look at how the cognitive ability. So, what we are basically doing is that within a short span of therapy and treatment, there are no medical treatment for it. There are drugs which we give to control the behavior. Something like risperidone may affect a little bit. If we find EEG abnormalities, then we have to really look and treat the epilepsy. But what we do is basically do therapies, and there are multiple modes of therapies which are being worked upon, and some of them are effective, some of them are more effective than others. So, short term focus is language acquisition, non-verbal communication, reduction in challenging behaviors, and as the brain grows, we are also bothered developing cognitive abilities, if possible educational success. So, assumption is accurate early identification of a specific neurodevelopmental disorder in childhood should help us connect to specific intervention and treatment option. that may optimize functioning for children and families. So, in 0.08 second, these are the number of therapies which you get if you type it in Google search. Look at it. Some of them are general, like auditory integration, sensory integration, I told you with that coherence theory. Applied behavior analysis is specific, discrete trial, LOAS, holding therapy, dolphin assisted, whatever works. Vision therapy using the computerized vision tracking, psychopharmacological, floor time, music therapy, social. See, you can just type and verify all this. Evidence base, antecedent based intervention, computer aided, discrete trial, extinction, assessment, functional communication, training, naturalistic intervention. So, just go through it, some of them. If you want, you can go. And where does this leave us now? All this. Lack of current evidence does not equal lack of effect or potential effect of treatment. That it does not mean that what is being done, because it has no quantification or definite relation to cause, is not effective. It works. So, people who say that autism is untreatable is not right. There are effective ways of treating it, but on the other hand, there are some people who claim that they can cure autism by physiotherapy or by everybody is, this is a free for all market. So, anybody who brings a treatment says claims, but science is still at one level does not believe all that, clinical, because there is nothing else. So, but we should still be very, very aware of techniques which may harm the kid, and because there is a lack of information, so there is a lot of ignorance also. A lot of people to advise people, but good reading material is available on the internet also. So, the advice which goes to the parents should be taken care of. Some interventions do make a tremendous impact. So, how do we best serve? What works for which children and why? What is the meaning? Why are you training? What are you training? Are you training a kid to become independent? That has to go on with sensory integration, self-help skills. If you are seeing a child at 15, one should also be bothered what outcome you are expecting. There, a child who can take care of himself at 15, but is not working because of his lack of social skills, and we do not know what is skill, the focus will be different. Rather than focusing on real language acquisition and sensory integration, what you should aim at helping that kid find out the specific skills that kid has, and each kid will have it. Developing a vocational training, and then compare that. So, we are having an improved understanding of the disorder, interventions and investigations. So, again as I said, just to reiterate, these are the stuff which we have to really work with these kids. Again, this is, I will just skip through all this quickly, you can just read it. So, these are the type of thing which we do, psychologist, occupational therapist. You can skip some of these slides. So this is important, lack of social interaction, impaired use of non-verbal behavior, lack of peer relationships, failure to spontaneously share enjoyment, interests, etc. with others. Theory of mind has been brought out in the capability of human mind to understand thinking of the other mind, of the other person in perspective to your own mind. So, that is what is considered to be lacking. The autistic mind, whereas a paranoid schizophrenic takes every stimulus from the environment, integrates into one's own thinking and builds up a delusion. The autistic mind is actually not taking any stimulus, and it is responding to the internally generated stimulus more than anything else. Behaviors like obsession, tics and perseveration. So, you can see a lot of videos actually on the on YouTube and Google, you can find out. Change in routine is very stressful, may insist on particular furniture, food and meal, symmetry. These if you look at it and if you remember what we talked about obsessive compulsive disorder, these things will almost fit into that, but OCD again, as I said, the person develops after having a lot of long normal life, and these kids all levels of intelligence, those who are from gifted to those who have mental retardation. Savant syndrome, I told you about idiot savants who have special skills. Treatment can be divided in two categories: for core symptoms, which address behavioral, developmental and educational needs. Other as occupational, physical, speech therapy, they are not exclusive to disorders. Applied behavior analysis is one of the most common developed based on the reinforcement scheme of Skinner. What is occurring in the child's environment to cause negative behavior? This is the most important point. Again, strives to produce rapid and clear benefit to problems of social importance, uses objective and accurate measurements and analysis. Okay, anyway, I will stop at this. I just wanted to, before we finish this talk, I wanted to basically again emphasize that what we are treating is a kid. Let me tell you what simple thing, what I wanted to tell you is that if you look at a normal trajectory which is going on like this, autism has its own trajectory. So, left to its own, this autistic kid will also develop, he will also grow, he or she will also grow, have its own set of skills and intelligence. But because it is not falling into the way normal life is being led, so what we are trying to do is by training till we know the cause and or we develop medication or some other mechanism, by training we are trying to bring these kids to nearest to the mainstream. And this training, so you understood autism is going this way, we are just trying to do this. So, this can range from mild autism, high functioning autism where symptoms are less, to core symptoms, and but the purpose remains the same. They are, we should allow them to be what they are and still train them to survive in the frame of the world by developing their skills, by intellect, by cognition, by language, and training the skills like you train any other kid. So, it is not hopeless. So, I will stop at this, and the next session we will talk about some other problem of children. Thank you.